Hello, am I audible, everyone? Hello,
Voice is low.
hello, am I audible now? Hello,
Yes.
yes, okay. So, hello everyone, I welcome you all for today evening session. And today's module for understanding is about exercise prescription for older adults or elder adults or geriatric population. So, as a physiotherapist, our aim is, or the occupational therapist, our aim is to prescribe exercises, right? Yes or no? Hello?
Yes.
Yeah, exactly. So, whenever we go to a doctor, so what does a doctor do? He prescribes you medicines according to the dosage, according to the time, according to the symptom, and according to your particular usage of the medication. It could be in form of tablets or cough syrups or injections, anything, right? So, as a physiotherapist, our aim is to prescribe exercises. Again, it should be in proper format for better usability, for better understanding, for better changes, or for better exercises tolerance. Is everyone with me? Any difficulties?
Yeah, ma'am.
So, before going to exercise prescriptions, there are few things what we need to understand before you prescribe. First is we will be understanding about introduction, then we'll be doing pre-health screening, examination and assessment, and prescription part. So, at a biological level, aging results from impact of accumulation of a wide variety of molecular and cellular damage over time. This leads to a gradual decline in the physical and mental capacity and also is contributed to the growing risk of disease and ultimate death. So, any individual about 65 years of age is considered to be older adults according to ACSM guidelines. ACSM is American College of Sports Medicine. So there are different changes which happens with the age, normal physiological changes which happens with the age in every systems. So we'll be discussing first every systems, and then we'll go ahead. So in cardiopulmonary system, what are the changes which happens with age? First is the resting heart rate usually becomes unchanged. Your maximal heart rate keeps reducing. Your maximal cardiac output, your stroke volume reduces. The blood pressure keeps increasing. Your cardiac flexibility and the cardiac contraction keeps reducing with the age because of compliance of the ventricular walls. For the breathing, again, your residual volume keeps increasing. Your vital capacity reduces. The person's tidal volume to take the inside breath, he also reduces if they have any pulmonary issues. With the musculoskeletal system, major is the muscle strength reduces, endurance reduces, the amount of the muscle units and the muscle size reduces, which is also called as sarcopenia. In the bones, it leads to reduction in the bone mineral density and the overall strength of the bone. The increase in the body fat percentage keeps increasing. The glucose tolerance is reducing and the recovery time takes a longer time. So these are the major effects of aging which happens on such physiological functions of our body. If these physiological functions are being affected, obviously your exercise prescription and your health screening will keep changing. Okay, everyone with me?
Yes.
So before going to this part, whenever you are doing any health assessment, there is something called as pre-health screening, which is the most important part before you start assessing the patient. Now, what is a pre-health screening? With the age, there is an enhancement of the chances of cardiovascular and metabolic diseases keep increasing because, as you know, the lot of changes happens at the in metabolic level. Also, the inflammation keeps increasing, and also the body type and the changes inside the organs keep increasing. Medical screening is very important to be done in any individuals, and specifically, it is important to be done in older individual. Okay, for that we have to use something called a SPARQ plus questionnaire, which has to be taken. And also, it is very important for a physiotherapist or occupational therapist to ask whether do they indulge themselves in regular exercises or they don't do any exercise. Imagine a person has never done exercises in their life and is coming to you for maybe knee pain or any hip joint replacement case, okay, and suddenly you ask the patient to start doing squats and lunges. Obviously it is not possible for them, and that can also increase their pain. So always it is important to ask in history about the exercise or the physical activity history, whether the patient is able to do the exercises or not. So what is pre-health screening? Basically, there is something called as PARQ questionnaire. So, what is PARQ? PARQ is basically physical activity readiness questionnaire. In this questionnaire, this questionnaire can be taken by your physician or the physical therapist or the occupational therapist. In this questionnaire, there are few general questions which has to be specifically asked to the patient. The questions are specifically like, do they have any heart condition, or they have any pulmonary condition, osteoporosis, cancer, any cardiovascular conditions, high blood pressure, metabolic conditions. So basically, what we usually ask, whatever the questions are there, you have to just tick yes or no. Okay. So once you take this physical readiness questionnaire, in this we understand what are the major complaints what the patient has. If there are more than 3 to 4 core morbidities, you always have to put the patient into risk. So one is a low risk, then is a medium risk and the high risk. In low risk patients, it is very easy to start with exercises. But in the patients, if you feel that they are medium and the high risk patients, you have to always ask their physician, their cardiopulmonary physician, to see whether the exercises have to be done or not. So this questionnaire is there in ACSM. This is 2014 PAQ. Nowadays, there are the new ACSM guidelines have been updated. So the latest, which is I think 2022 or 2023 PAQ, which is available in the ACSM guidelines, which is the most updated one, and that is what you have to take in your older individuals. So, with this, we will understand whether the patient is at the higher risk or not a higher risk. Also, with this, you have to start taking the history of the risk factors. So, in risk factors, the first important history what you take is the age. Obviously, the patients, older individuals, what you're seeing are at the age of about 45. Family history, if they have any strong family history or they have any addictions like cigarette smoking or alcohol take. Physical inactivity, if the patients are not physically active. Patients are obese if their BMI is over 30 kgs per meter square. Hypertension, dyslipidemia, diabetes are all these are the risk factors which has to be asked and taken into the patient. So these are the positive risk factors. There's something called as negative risk factor. What is a negative risk factor? Why it is important? What is a negative risk factor?
But not detrimental to their health.
You're not audible. I'm extremely sorry. Hello? Hello? Okay. So negative risk factors means that the patient is at a safer side. So HDL, which is a high density lipoprotein, if it is more than 60 milligrams per deciliter, it means it's a good sign that the patient is cardioprotective. So HDL is one of the lipids, which is a cardioprotective lipid. LDL, VLDL, total cholesterol, these are cardionegative lipoprotein, and this can also lead to higher risk of atherosclerosis. So these risk factors, the PACU readiness scale, and the patient's history of are they exercising or not exercising has to be taken. After taking, you will be assessing the patient into low risk, medium risk, or high risk. Okay. So there is one more thing. When you ask the patient, are they regularly exercising? So they will tell no. So there are three different scenarios. If the patient has no cardiovascular or any renal diseases, the medical clearance is given. If the patient has any renal or metabolic disease, medical clearance is very important. Or if they have any symptoms which are cardiopulmonary or renal related, medical clearance is important in such patients. And always start with, when you get the clearance, always start with the most low intensity exercises in such patients. Is everyone with me? Any difficulties? Yes, no?
Yes, ma'am. Okay.
Okay. So, after you have done a pre health screening and risk assessment evaluation and the history taking properly, then you will understand whether the person is low risk, medium risk, or high risk. Let's consider the patient is a low risk patient. Okay. Then you have to go to the in detail physical assessment evaluation. In physical assessment evaluation, the most common is the body weight. In body weight measurements, you have to go for body composition, BMI, which can be done by the BIA machine or by the skin fold measurements, and also by the basic weight to the height ratio, where we understand whether the person is obese, overweight, or normal weight. Then is a cardiopulmonary rehabilitation evaluation which has to be done. In that, you have to check their vitals, which is the most important, where you check their BP, heart rate, saturation, respiratory rate, the rate of perceived exertion, also their pulse rate. How is the rhythm, and also the JVP, or if they have any specific symptoms about breathlessness or chest pain. After that, you have to auscultate the patient. If you in auscultation, you have to hear the pulmonary sounds and the heart sounds. Can anyone tell me how many heart sounds we have in our body before
Love,
going ahead?
love,
Only
love,
lub.
love,
Okay. Okay,
love.
that's heart sound. Where do you auscultate for heart sounds?
Uh, Mitral, like apical and lower intercostal fifth or something.
There's only one space you auscultate for heart sounds, or how many areas are given for, auscultating the heart sounds?
I think the four.
Yeah,
Mainly
four.
in
Okay.
one and
I want you all to name the four heart sounds.
Mitral valve, then bicuspid,
Four.
tricuspid, the pulmonary. So
No, 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 no. Anyone else? S1, S2, yes, these are lub and dub, but I want the areas. So you just randomly put your stethoscope over anywhere to hear the heart sounds? I-
S1 is the loudest, ma'am. That I know.
So where do you hear the S1 sound? That's what I'm asking. Okay. So there is something called as aortic area, pulmonary area, tricuspid area, and mitral valve area. So these are the areas specifically in the aortic area and the pulmonary area. You'll hear, the mitral, the bicuspid area and the pulmonary valve. You'll hear proper S1, and for S2, you will hear at the mitral and the aortic valve. Okay, the S1 is the most loudest as compared to the S2, and there is something called as Erb's point also. So specifically, there are five heart sounds which you have to auscultate. Erb's point is a point where you will hear S1 and S2 both. But if you want to specifically hear S1 and S2 alag alag, then there are regional points where you have to put your stethoscope there and hear the sound. Okay, so S1 is for mitral and tricuspid areas, S2 is for aortic and pulmonary areas. Is everyone with me? So there are five heart sound areas. Okay, always remember. Erb's point is the area where you will always hear S1 and S2 clearly, both the sounds. For S1, you have to always put your stethoscope over the mitral and the tricuspid area, and for S2, you have to specifically keep over the aortic and the pulmonary area. For pulmonary sounds, anywhere inside the lungs, so in the lungs, you always divide into three zones: upper zone, middle zone, and lower zone. So you have to upper zone is specifically from second to the fourth intercostal space, lower zone is four to six, and middle zone and the lower is six to eight. So you have to keep your stethoscope over and ask the patient to take a deeper breath and breathe out. That's when you will understand understand the air entry. So there are two types of air sound. One is the bronchial sound and one is the vesicular sound or the tracheal sound. So these are the normal breath sounds what you have to hear. If you hear something else, it means that patient might have some kind of pulmonary issue which has to be resolved before starting with any exercises. If you start exercising and the patient has reduced breath sound, that will create more pressure on the lungs and the patient will get desaturated faster. Everyone clear? Any difficulties?
No.
Okay. So then it comes for palpation. So the major things what you have to do in palpation is check for edema. If you see that the patient has bilateral edema in the hands and legs, it might be because of some renal issues or it could be because of right heart failure also. If it is in any one leg, it could be musculoskeletal problem because of arthritis or any injury. Cyanosis. Cyanosis will tell you whether the person's peripheral saturation or the tissue saturation is good or not. Erythema, if there is any inflammation or if there is any trauma, there would be redness and swelling in that particular area. Pallor will always tell if the circulatory imbalance is present or not. In palpation, also you have to specifically check for the peripheral arterial pressures and their rhythms. Next is a musculoskeletal system. In musculoskeletal system, very important is always first go for range of motion assessment, whether it is full or not. Check for tightnesses, check for the end field, check for the manual muscle strength, okay, and also check for the muscle endurance. Once this is cleared, then you have to go to the neurological assessment to see whether the higher mental functions are well, the cranial nerve examination is good, and whether the patient is able to follow your commands or not. After all these things are done, then you have to go for the lab finding and reports if available. For lab finding specifically for you, it is important to check for the hemoglobin levels. Why it is important to check hemoglobin levels? Anyone?
Most of the adults they absorb less iron, and
Okay, but yes,
so that
perfect.
that can lead to some kind of like symptoms when doing exercises. Um,
Anemia. Okay, yes. So again, if hemoglobin is a major carrier for your oxygen, if your hemoglobins are less, and with the age, obviously the hemoglobin levels will drop. The person will be easily desaturated with exercises. If you feel that the hemoglobin is less than 8 or 7, please don't do any exercise. It should be more than at least 9 to make sure that the patient is at the safer limit and the patient is safe while doing the exercises. Very important. Then you have to always check for ESR and CRP. What is ESR and CRP?
yes, exercise and the other one, can you
You're not audible at all. I'm sorry.
ESR is
Yes,
erythro
erythros,
yeah, erythrocyte sedimentation.
erythrocyte sedimentation rate.
And what is CRP?
C-reactive protein.
Exactly. Why it is important for a physiotherapist to know this? How will it affect the exercises?
Elevated ESR can mean there's a lot of inflammation. So that might be like some of the arthritis changes, or something else going with the body.
Yes, if the patient's ESR and CRP levels are very high, it could lead to some kind of hidden inflammation which we are not seeing. So, when there is an inflammation in our body and you start doing exercises, maybe in moderate or high intensity exercises, that can again make the patient more weak and also that will make the patient's heart rate go very high and that can also lead to damage. Okay, then you have to check for the lipid profile, renal profile, liver profile, the vitamin D, calcium levels, B12 levels, magnesium levels, their uric acid levels. Everything has to be thoroughly assessed to see whether it is normal or not. Okay. Sometimes all these patients who are older individuals will be on something called as blood thinners. Many of the patients are there. So in such patients who are on blood thinners, you have to specifically check for their PT-INR ratio. If the PT-INR ratio is anything above 3 or 4, please don't do exercises. Okay. Now what is PT-INR ratio? Anyone? What is a PT INR ratio? So PT means prothrombin time. INR is an internationalized, standardized ratio. Okay, so basically the PT-INR ratio will tell us whether how the blood is working properly. Is it very thin or not? If the PT-INR ratio is very high, means the patient is on blood thinners and the blood is very thin. So any damage or any um, trauma to the body can lead to immediate hemorrhage and sudden blood loss. If the PT-INR ratio is between 1 to 2, it means the blood thinners have been properly maintained and the patient is safe to do the exercises. So, whatever points I'm telling you, these points are not written somewhere in the books. This is all with experience. This is all with knowledge, what you keep learning on day-to-day basis when you start treating such patients. Okay. Vitamin D, calcium, very important. If the patient is extremely less in vitamin D, if you know the bones will be weak, so exercises will make the patient more into pain. So D3 level should be anywhere about 35 or 40. Again, if the patient has a lot of neurological symptoms, B12 might be reduced. So B12 advocate is very important. So all the lab findings should be it's in normal values to start any set of exercises. Then also check for their X-rays, ECGs, or any 2D
Ma'am,
echo,
we cannot
PFT
hear you.
reports. Hello?
Ma'am, we cannot hear you.
Hello, am I audible?
Yes, ma'am.
Yeah. So for reports, basically you have to always go and check for the X-rays, 2D echoes, PFT reports, or ECGs if are available. Always interpret properly and see whether the patient is in the safe zone or not, and then only start with exercises. And the last step is cardiopulmonary fitness testing. So with this testing, you will understand whether the patient's what is the patient's functional capacity, what is the patient's capacity, and from that you have to start the exercises. So maximal test, the most common is a gold standard Bruce protocol. Submaximal test, you can always 12-minute walk test. In field test, you can also go for the shuttle test. So any of the tests you can use according to your patient, according to their suitability, according to the availability. And after this, you will understand the physical capacity. And from that, you have to start doing and prescribing the exercises accordingly. Everyone clear?
Ma'am, I have a question. Uh,
Yes.
if there's no edema in lower extremity, but there's lot of edema in upper extremity, what is the possible cause of that?
It could be any lymphatic drainage problems. It could be any person who is wearing a very tight upper limb garments, or the person has any um, infection or cellulitis, or the person has any trauma in any of the joints which can lead to swelling. So these are the most probable cause for upper limb swelling.
Can it be because of some pulmonary edema or like that?
Not really. Patients who
Oh,
have pulmonary edema never usually, I've never seen any patient having specifically upper limb swelling.
okay, ma'am. Thank you.
No, no problem. Next is to assess the muscular strength. So for muscular strength for upper limb, if you want to assess, you have to always ask the patient to do bench press. Okay. So again, you can modify according to your patient. So if you assess the muscular strength, you have to first find the 1 RM technique. If 1 RM, usually in older individual, we don't go for 1 RM because they cannot lift so much heavy. So we do something called as 10 RM. So in 10 RM, it's a technique where you make the patient give them a weight which is comfortable for them to do for 10 repetition maximum. And from that, you have to put into a formula and find the 1 RM. For upper limb, the most common is the bench press technique. For lower limb, you have to go for leg press. For muscular endurance, for upper limb, you have to go for push-ups. You can again modify the push-up according to the patient. And for lower limb, you can go for squats, and also some patients you can go for sit to stand. For flexibility, you have to check the upper limb back stretch test to see whether the upper limb is flexible or not. For lower limb, you have to go for sit and reach test. So this is an entire in detail evaluation as assessment you have to do before starting or prescribing any set of exercises. Clear?
Yes, ma'am.
And also, one of the important things I have missed here is gait assessment, which I have already mentioned before as well. Gait is very important assessment which has to be done. If the patient is not able to walk, okay, how will you make the patient do treadmill, or how will you make the patient do walking exercises? So if the patient has any complaints like joint pain or any other problems, you have to first tackle the joint pain. You have to make sure that the patient is fit, and then only start giving fitness based exercises to them. Before, if the patient is not fit and you suddenly ask the patient to go do cycle, do walking, lift weights, it is not possible for them. So, first treat the underlying cause, underlying problems, make the patient fit for the particular activity, and then start any fitness based exercises. There are most common physical performance tests which are available in the market where you can do these tests in order to understand the physical capacity. So, first is a senior fitness battery test, then is a short physical performance battery test, usual gait speed, and 6-minute walk test. With this test, you will understand the patient's physical capacity. Stamina, the performance test, the muscle strength, the flexibility, and also their balance and coordination. So, these are the tests which you usually do and which should be done in your setup, because these are the objective measures. So, when you do the exercises, okay, and after maybe 1 2 months, you do the same test to see whether the components have improved or not. Clear? Yes, no? Okay. So now we are coming to prescription part. Okay, so once I've already mentioned that first treat their problems, treat their pain, treat their balance, coordination, treat their strength. Once you feel you have treated everything, now you have to come to proper fitness assessment. So there are how many types of exercises are there? Anyone? How many types of different exercises are there?
Aerobic and non-aerobic.
Perfect. What is non-aerobic? I've never heard anything as non-aerobic. Aerobic, yes. What is aerobic again? So, aerobic exercise is a type of exercise which is done in presence of oxygen. Okay. So, before going to the testing and prescription, we have to understand the different types of training. Okay. So, one is aerobic training. It's a training which is done in the muscles and in the body in the presence of oxygen. Second is strength training. Strength training is a training which is done when the muscles are loaded with some amount of the weight, and that will help you to improve the muscle strength. Then is endurance training. Now, what is an endurance training? Where you will train the patient in order to do a particular task for a very long amount of time. So, endurance training specifically helps to improve your stamina. Then is flexibility training. Now, what is a flexibility training? It is a training which is done in order to improve the muscle length and make sure the joint mobility and the muscle mobility is good. Then is, does everyone understand the main four types of training?
Ma'am,
Yes, no?
you please repeat? I was sorry, I got distracted. Can you please repeat?
Which part do you want me to repeat?
This is the one that you discussed right now, like just a couple of
Okay.
seconds.
So, before going to the prescription, we have to understand the different types of training programs which are there to train the patient, right? So, first training is aerobic training. So, aerobic training is a training which is specifically given to patients where the exercises are done in presence of oxygen. Second is strength training. Strength training is a training which is done to improve the muscle strength, where you give a particular load to the person in a particular sets or in particular repetition to improve their strength. Then is something called as endurance training. Endurance training is a training where you give a particular load to a patient and ask them to do for a longer amount of time, and such training helps to improve your stamina. Then is flexibility training. So flexibility training is a training which is done in order to improve the muscles flexibility, joint flexibility and muscle flexibility. If the flexibility is good, definitely the resistance training, strength training and aerobic training will be done well. If the patient is not flexible, the chances of having joint injuries will always increase. Everyone clear? These are the basic 4 trainings which are done. Yes, no. Clear?
Yes.
Okay. So now there are different other types of trainings also, like circuit training, interval training. Nowadays there is low intensity training, high intensity training. Have everyone heard about these? Yes or no?
Yes.
Yes. So can anyone tell me what is a low intensity training? Low intensity interval training.
They kind of exercise, well, they have so it's like,
Sorry, but you're not audible at all. You can type it in the chat box. Anyone else?
Ma'am, what I know about that is that it will not involve more energy spending exercises. Especially, we use this for geriatric population because the energy consumption for this thing will be less. So, like, we will maintain the low intensity throughout the thing with regular interval to avoid fatigability, ma'am.
Perfect. Very good. Very good answer. So, and what is high intensity training? High intensity training, again, it's the
So
opposite of
once
what low intensity exercises, right? Where the heart rate, the exercises are such where the heart rate shoots very faster in a very short amount of time, and the rest period is less as compared to the low intensity exercises. So these are little riskier for an older individuals. So our aim is to focus always on low intensity interval training, where the exercises of low intensity, where the heart rate is not going to be shooted, and with the interval, the patient will get enough rest. Clear everyone the types of training?
yeah, ma'am.
Okay. So now we'll go to the exercise prescription part. So exercise prescription has to be done always in a format. One is Fitts principle. So what is Fitts principle? F stands for frequency, I stands for intensity, T stands for time, and T types of time. Okay. And also there is something called as new part which is added according to the ACSM is called as VP. Fit VP. What is V means volume and P means progression. Okay. So first we'll go with the aerobic or endurance based exercises. The frequency according to the ACSM guidelines in the older individual has to be 5 days per week for moderate intensity. Okay. Or 3 days per week. Intensity should always be in between, for according to the box scale, it should be between 5 to 6. For vigorous activities, should be 7 to 8. Time usually 30 to 60 minutes. For moderate and for vigorous, 20 to 30 minutes. And type, it could be walking, it could be cycling, it could be aquatic exercises, or it could be elliptical. So these are the different types of aerobic and endurance training. Then is resistance or strength training. It has to be done according to the ACSM in older individual. It has to be done 2 days per week. Intensity, always start with light intensity where you have to start with 40 to 50% of 1 RM. So as we had discussed in physical assessment, when you check the muscular strength, you have to check in a format of 1 RM. Imagine if the patient is able to take for upper limb 10 kgs. Okay. So what is the 50% of 10 kgs? 5 kgs. So always start with 5 kgs as a light intensity. For moderate and vigorous, you can start with 80 to 60%. So specifically, the in time it should be around 1 to 3 sets, and each set would be for 8 to 12 repetitions. If you want to improve strength, it should be between 8 to 12 repetitions. If you want to improve the muscle endurance, the repetition should be between 10 to 15 repetition. And for every day, suppose you're focusing on upper body one day and lower body one day. For upper body, you have to include 8 to 10 different exercises. For lower body, you have to include 8 to 10 exercises. And type for progression, again, you can start with weight training. Maybe you start with half a kg, then go for 1 kg, 2 kg, 3 kgs. It can be done in format of therabands also. Start with the most least resistance theraband and increase the theraband. And also you can start with weight bearing exercises and keep increasing the weight bearing exercises with the help of adding the cuffs and weight to the arms and legs. Everyone clear?
Yes, ma'am.
Next is flexibility training. Again, it has to be done for more than 2 to 3 days per week. Intensity, you have to stretch until when you feel the stretch. The time you have to hold for 30 to 60 seconds. And these flexibility exercises usually have to should be done in the cool down sessions. So there are two things. First is warm up and cool down. Warm up and cool down is the most important part which you have to always do in an older individuals. Please don't miss. If the patient is a patient who has heart failure, or the patient who has coronary artery disease, okay, if you suddenly start with high intensity exercises, there will be sudden increase in the heart rate and the patient can have chest discomfort. When you start with warm up, you know that slowly your heart is trying to take the load and the patient will start getting adjusted to the exercises. So warm up is very important. So in warm up, you have to focus on all the bodily movements and dynamic flexibility exercises. In cool down, you have to make sure that the heart rate is coming back to the normal levels at the resting levels, and the flexibility exercises will be static stretching exercises. Before starting with exercises, please always check the vitals pre and post exercises to see whether the vitals have come to normal levels or not. If they are not coming to the normal levels, means there is some kind of autonomic dysfunction at the cardiopulmonary system. Everyone clear? Yes, no?
Yes, ma'am.
Okay. So there is one of the components which is very important for you to start in training also, something called as balance training. Balance training is a training we usually do not prescribe in normal individuals or younger individuals, but in older individuals, it is the most important part of training, because this will only help to reduce the falls and reduce the hospitalization. So, balance training is a program which is very important for older adults, aiming to reduce the fear of fall, improve their balance, to make sure that they are doing activities of daily living, which contributes to better health and quality of life. Balance control is a foundation of person's ability to move and function independently. However, the balance control declines with the age and can have impaired balances according to the different factors which are there. So, in also balance, you have to first assess the patient for the balance to see what is the start level of balance, and then accordingly start training the balance. So this is one of the charts which I've taken from one of the research articles about balance training in geriatric population. So exercises has to be first started, always start balance exercise in sitting and then progress to standing exercises and walking exercise. So in sitting, maybe you can start with sitting, reach outs, then going for any cognitive task like sitting on the ball, then doing any kicking of the ball, upper limb activity, lower limb activities. So these are the sitting exercises. For standing, maybe you can start with sit to stand first, then start with holding the weights, doing all the leg exercises, then stepping exercises, then dual task and multiple task at the same time. So these are the different set of exercises and different set of modifications what you can do in sitting and standing. Everyone clear about exercise prescription, balance training, how you have to prescribe, what is the FITS principle, how do you prescribe? So there is one thing I would want everyone to discuss first. So there is something called as cognitive exercise also. What is cognitive exercise?
It's retraining of brain, like cognitive functions, memory.
So
Um,
how will you train as a physical therapist or occupational therapist? Is it important for us to do that? Because that is also one of the important exercise prescription part, which not nobody usually talks about, but we have to actually include that as an exercise prescription also. So what is cognitive training?
we cannot do cognitive training like a psychologist or OT, but we can incorporate that in our exercises, like maybe we are trying to train the abductors, and then we put something on the floor, and then they memorize where exactly it is without opening their eyes, something like that.
It is
Okay.
basically a mental activity for improving memory, focus, and problem solving, etc.
Perf- Perfect. Can you give us a few examples of that which you have treated in patients?
Yes, like uh, they can solve puzzles, or it depends on individual patient, like on their cognitive level. So first we give them easy task to solve, like they can separate the colors, or like do the ring activity to put it in some, or like beats exercises, something like that. So it depends on patient's cognitive level.
Okay, very good, very nice, everyone. Again, this is very important for to include the cognitive exercises. Why? Because if your brain is working better, if it's working faster, obviously your body will work faster, the reaction time will get better, and the patient's ability to do the activities will get better. So, jigsaw puzzling, vocabulary training, card games, separating the colors, making drawings according to what you have asked, finger hand coordination, dual tasking activity, cross arm training. Cross arm basically means upper limb, right upper limb to left lower limb, left upper limb to right lower limb, such activities. These are cross brain exercises. Very commonly done in patients, specifically neurological rehabilitation, but make sure that to incorporate such activities in all older individuals. You can give them few tasks to do at home, like folding all the clothes in 1 minute. So that will again make their speed better and also endurance better, and the task also better. You can ask the patient to take two, three items from one place to other place and see how fast are they able to do. And hand-eye coordination is very important. You can start with all the frankel based exercises for coordination. You can ask about the sensory awareness. So many of the patients have few senses which are lost in patients, like vision is affected, hearing is affected. So vision based exercises or sensory based exercises awareness can help to improve their cognitive health and mental health. Nowadays there are many video games, there are many app based games which are available in order to improve their functions. So there was one app which I came across, I don't remember the name, where it was about the visual reaction time. So there are 4 5 green dots, and you have to tap on the dot which immediately turns to red. Okay, so that will tell me about the reaction time, how fast is the vision and the hand coordination. Also, there was one of the games which I came across where the patient has to keep tilting the head according to the direction which the person is moving inside the app. If the person in the app is going straight, the head will be straight. If the person is tilting the head on the right, the person's will shift on the right. So these are the different games which are available in the market. Again, you can find it on the apps, again on the Play Stores, where you can download in the patient and you can give them. For exercise prescription, nowadays there are something called very important objective assessments which are there, like Fitbits, smartwatches, apps in the phone which will help you to track the heart rate, track the step counts, track their intensity of exercises, and track what kind of exercises they have done. So you can also incorporate such different gadgets also to make the patient more aware. Nowadays, people come and tell me that the The auntie comes into my clinic and tells me that I have walked 6,000 steps in this week. So in that, in the phone, they will see the chart, is the 6,000 maintained, so that can give them more feedback they are doing better, and the physical activity will keep increasing. So you can take help of such gadgets, such watches, such app based games, to make sure that the prescription of exercises is good, the compliance is good, and the patient is able to follow the exercises properly. Clear? Yes, no?
Yes.
Yes.
These exercises can be done in your in supervision, non-supervision, also on telerehabilitation. Please see whether the patient is fit for unsupervised exercises or not. Some patients who are easily losing balance, you should never ask them to do the exercises at home in unsupervised situation. So again, that is a very important thing which you have to consider. Always exercises on the light stomach. You should always have some meal. Pre-exercise meal is very important. Ask the patient to take all the medications before starting any exercises. Good water intake, enough break, good uh, lighting, good ventilation is very important to do exercises. These are the points which we miss to tell the patients, but you have to tell those. Clear?
Yes.
Okay. I hope I was clear. Thank you so much. And yes, I will be sharing the ACSM guidelines for exercise prescription. Do not worry. The lecture which I've taken is actually from WHO and ACSM. So you will get everything with the material with you. Thank you.
Thank you.
Thank you, ma'am.